So my name is Martinez, one of the physicians here at Pella Regional Health. I do family medicine with Obstetrics. Yo soy el doctor Martínez, yo soy uno doctores aquí en Pella. Yo hago medicina familiar con obstétrica. Tengo bastantes mamás y bastantes bebés que veo aquí en Pella y en Ottawa. I grew up in Tegucigalpa, Honduras, so up to the age of 18, I was in another country. During that time, I went to a bilingual school, so I learned English. I didn't know what I wanted to do, but during high school is when I applied for schools here in the United States, and I was fortunate enough to get into a school here in Washington University. I'm married. Morgan is my wife. She and I met, I was part of InterVarsity Christian Fellowship. We were doing a spring break project in St. Louis together, and they told us, you two are going to be working together. I was like, all right. And then we just hit it off. We just talked for hours and hours. And after that, we just kept in touch. From there, when we got married, we always wanted to have a family. We have 2 kids. When we were looking for jobs with my wife, she actually went to college here in Central College, right? And when I was looking for a place to practice, I was looking for a place that was rural and a place that did lots of OB. So we were looking for all these different hospitals in Iowa, basically, because my wife wanted to be closer to her grandparents. And as we were looking for those hospitals, we noticed that Pella does a lot of OB. Not only do they do a lot of OB, but they have not one provider or 2 providers that do OB, but we have a good number of them, like 8 or 9. Sometimes 10, depending on the season. So I always felt like it would be a good group where I wouldn't feel alone, that I would feel like I have colleagues that are really good at what they do with OB in case I need their assistance. One of the earliest experience in residency, I remember just being with OB, and we had all these families that would be there for the delivery, and just the joyful aspect of like, hey, there's a new member to our family. And I remember falling in love with that, being like, I want to be in this position. As I finished residency, I did a fellowship with the perinatology team. And basically during that fellowship, we were treating a lot of our high-risk patients, doing a lot of cesarean sections, treating lots of complicated things. And I just remember to be part of that was just both a privilege and an honor, and it was something that I really enjoyed. So what's different is like for some of my patients, I'll be doing my own C-sections. So not only am I taking care of your OB and everything like our other providers, but for a few patients, I will also be the surgeon the day that we're delivering the baby. So I know that obstetrics in particular can be very stressful. As you're thinking about delivering your baby, it's very stressful to think about all the variables and all the things that can happen or may happen. So it's always important to me to be like, hey, we need to have a plan. We need to ask questions. I think my patients tend to be very comfortable. I always tell my patients, by the time we go for the delivery, I just want you to be like, are you ready? Are you ready? And we both are on the same page. And for most of the time, we're able to achieve that.